The national regional blended trend factor is essentially the Medicare Shared Savings Program way of accounting for inflation. So they take the prices and they blend them between the nation and the region and look at the change over time. And these are actual prices that are comprised of the fee-for-service population. And so important things to remember kind of as we talk through this and walk through this is that piece, that it's actual prices. And because it's actual prices, it is subject to a ratcheting effect. Now, we talked about ratcheting in a different way earlier. And so I want to spend a couple minutes just separating these two ratcheting effects that we're going to talk about. Both of ratcheting effects are referring to times when the success of the individual ACOs or the program in general actually makes future success harder. Now, that the individual level ACO ratcheting occurs when we're rebasing. So you move through a contract cycle, you're in a new contract cycle, and you've improved. So now your new benchmark is set off of improved prices. And so it's a little bit harder to achieve savings in further cycles. That is not the type of ratcheting that we're going to be talking about now in this video. We're talking about a ratcheting effect that can be the result of a single ACO or actually the collective ACO. And that's the ratcheting effect of a region. So we're using the regional prices and we're using the actual prices as they change over time to say this is how much inflation is. Well, let's pretend for just 1 minute that it's only regional. Let's ignore the national piece for now. And let's pretend that there's one ACO that actually has every beneficiary in its region. Well, the way CMS has set this measure up is it includes all fee-for-service beneficiaries, regardless of whether they're in an ACO or some sort of shared savings program or not. So we would take that measure, and let's say naturally it would have had a 5% increase over time. And the ACO is really successful, and they drive that trend down to 3%. Well, now we're going to update at that 3%. So the ACO is automatically lost out. Its performance has made savings harder to achieve. Now, Medicare is aware of this, and they're introducing a rule in 2024 that's meant to help adjust for that and deal with that a little bit. But as the rules currently stand, there is this ratcheting effect that occurs throughout the region. Now, CMS has blended national and regional. And what that does is if you are really important in your region, you actually use more of a national change over time to adjust your region up or down. And that can be good or bad. Overall, it does help reduce that ratcheting effect. But let's remember that in the 2024 rule changes, CMS actually came out and stated our goal is to get 100% of fee-for-service beneficiaries into an ACO or ACO-like entity in these different programs. Well, if they achieve that, then 100% of the sample that we're going to be updating on is based or is involved in organizations that are trying to drive that trend down. So obviously something needs to happen. What CMS is going to do to address that, we will cover an entirely different video. It's very related to this video right now, but we're going to address the rules kind of as they currently stand. No ACO has any of the new rules in effect. So let's take a look at exactly how the national regional blend is calculated. Here we have a map of the national regional blended trend factor. And overall, this is actually really simple. And so I'm just going to walk through this very quickly, but we're going to navigate to a few other places within these flowcharts. And I want to point out a few CMS resources for you as we go through this. So we're going to start over here with the blue boxes. These are national. So national expenditures are actually produced by OACT, and they're for the National Assignable Fee for Service population. One just kind of interesting nuance, OACT does not include truncation in their calculations. And so if you were to go and take the normal truncation approach in MSSP for calculating expenditures and try to calculate a national, you're going to end up being lower than their national. Doesn't affect much in the trend factor, and that's all that national is used for in MSSP, but it's just good to be aware of that. So we then calculate the trend factor. We take the BY3 to BY1 ratio, and this is for updating BY1. So you do that in each year. You're always just going to take the ratio of the year you're looking at to BY3, and that extends through the whole course of the contract. So in benchmark years, you're updating to that. and then you're updating from BY3 to the PY in the future. So then we have to figure out this national component weight. And so you remember earlier in the video, I was talking about how if you're a bigger player in your region, you actually use more of the national. And as soon as I explain this calculation, we're going to take a step back and talk about how they do this component weighting. So on the other side over here, you do the exact same thing for the region. And your region in MSSP is all the counties in which you ever have a beneficiary that resides there. So if you have just one beneficiary living in a county, they're part of your region. Now, you don't get that full region. You don't take the full PMPY for a region and add that into the mix as an unweighted average. Basically, we calculate the weight of the importance of that county to your ACO, and the regions are assembled that way. So you may include every county that you have even one beneficiary in, but they're included at an extremely tiny weight, and so they don't have much influence. So essentially, it comes down to the counties that are really important to your ACO. So you do this for each and every year. And that's all these boxes are, is just showing that every year we do this. In BY3, there is no updating essentially, because you're updating from your BYs to your BY3, so it's one. And then once you move past that, you're updating to your PYs from BY3. Now I'm going to navigate here to look at how the component weights are calculated. So that's this box here for national and this box here for regional. So this is from the Medicare Shared Savings Program methods document. It's like a 70-page document. But this box right here, I pulled it out because it's very helpful in understanding these components. I'm not going to walk through everything, but essentially what Medicare does is they take the importance of that county to your ACO and they multiply it by the importance of your ACO to that county. And that gives you a county weight. Then they sum these up across all the different counties, and that gives you your national weight. And so that often is sometimes like 70% plus, but they add all those up, and then the inverse of that is your regional. So the more important you get to the more concentrated you are in your counties, the higher that number is, and the more of a national rate you're going to have. That is really important. Now, we're going to go back here, and I want to just point out a couple of resources from CMS that you might be aware of, but are really helpful when we're talking about regional expenditures. So you can't get regional expenditures from the data that CMS sends to you. You don't have all that information. You have the information on your beneficiaries, but you need information on all the rest. So CMS has provided a couple of different puffs, and these have county level expenditures and the ACO population by county. Now, I'm not going to go to these, but they basically take you to the CMS data page, and you can go and request any information, but the county level expenditures puff and the ACO population by county puff are really helpful. So the first one, the county level expenditures, gives you exactly what we're talking about. It gives you the HCC scores, it gives you the number of beneficiaries and person years, and it gives you the expenditures for each county in the country. Then the ACO population by county gives you the number of beneficiaries that you have in each and every county. It gives you them for every ACO that exists. And it does it for each of the beneficiary entitlement groups, and so that you can know the weight of that county. So you can go solve all of that. The only caveat is that they don't ever show any county counts of less than 11 beneficiaries. So you'll miss out on those really tiny counties that are probably not that important to you. But overall, you'll be able to find everything there. It's a very helpful resource. Thank you for joining us for this video. Hope it was helpful, and we hope to see you in future videos.